Hi, everybody. This is the Dr. Debunk Weekly Podcast Show. On this show, I'm going to be debunking the medical myths, garbage, and crap that's spread by doctors and other health professionals. Dr. Debunk is the medical truth teller. Dirty Little Secrets Part 2. More dirty little secrets. It's like you're looking in the closet of doctors or maybe at our dirty laundry. That's good. Okay. So Dirty Little Secrets Part 2. What's that about? Drugs, drugs, drugs. Drugs, drugs, drugs. It seems like we doctors are licensed drug pushers. I mean, that's all we do. Drugs for everything, all the time, all the time. Don't doctors do anything besides push drugs? Pull out the prescription pad as fast as you can? Not really. It's what we do. Don't expect a dog to bark and sound like a cat. We bark drugs. Arf, arf. No meowing here. So what's the dirty little secret here? It is a fictional belief that drugs used according to your doctor's instructions are somehow safe, even with long-term use. Debunk, 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 Dr. Debunk alert. It's partly true, but partly a lie. Okay, what does that mean? Short-term use of drugs are generally safe. Short-term intermittent use of drugs don't seem to affect the total quality of life or the length of life. Now, there are some exceptions, but we know this because we see people that have taken intermittent drugs and they live to be 90, 100 years old. Now, there's some exceptions, like I mentioned, but here's the dirty little secret that no one is talking about, but yet we know this as doctors. Well, doctors that have practiced over 20 years know this. All drugs, no exceptions, will kill your liver and or kidneys and other body parts if you take them too long. All drugs. I alluded to that in part 1. But why? Why is that? 2 big reasons. First, all medications or drugs generally have to be processed by the liver and then excreted by the kidneys or the bowel. And if you take the medication too long, generally it's 25 to 40 years, daily use, it will burn out the metabolic pathway of excretion. And then the medication now becomes toxic because you can't get rid of it. And so finally, it's going to kill your liver or kidneys, thereby killing you. Not a happy movie. And it's also killing other organ systems. More and more we see dementia, Alzheimer's. If you want that one, then just keep taking drugs on a regular basis. So that's the first reason. Second reason, all medications have a mechanism of action. And this is really related to reason number 1. And what that means is the medication basically interferes, alters, inhibits, or shuts down some type of function in the human body. Now, generally, medications affect enzymes in the human body. And so it is an enzyme that's being altered, inhibited, shut down, or interfered with. Now, this is an oversimplification of something complex. It's still basically accurate. Regardless, the drug's interfering, altering, inhibiting, or shutting down effects are not the problem in the second problem. The second problem is, what else is the drug interfering with, altering with, inhibiting with, or shutting down inside the body? The side effects. You may think that because you don't feel a side effect, it isn't happening. Debunk, debunk. That is not true. Every drug has side effects. It's just whether or not we can clinically observe them or feel them. And we doctors act like when you even get short-term side effects, that it's no big deal and that the cumulative long-term side effects are the same as the short-term. Now, that's just not true. Now, short-term side effects, they go away if you stop the drug. And we don't really see permanent problems. Now, that's not always true. There's some nasty drugs in my 32 years. I've watched what they've done. Short-term use, devastated, like women taking this drug called medroxyprogesterone. That's a progesterone drug. It's a fake progesterone. That stuff is lethal. Ladies, don't ever take it. Young women, if you're hearing this, that's that stupid shot they'll give you for birth control for 3 months. Do not ever take that. I've had many patients, 2 shots over 6 months, permanently screwed up their metabolism, made them fat, jacked up their periods. It's like there's no going back. And there's more than a few drugs that can do that. Anyway, but most of the time when you stop medications, the side effects stop and they don't seem to leave any residual effects. But what about when you do chronic medication use all the time for your blood pressure or whatever else? The long-term chronic side effects are very different than short-term effects. And we doctors act like if there's no obvious short-term effect, then that means there's no obvious long-term effects. Debunk, debunk. That's not true. The problem is that patients today are being told they have to stay on their medications for life and that there's going to be no long-term side effects. Debunk, debunk. That is not true. There will always be long-term side effects. But here's the real nasty, dirty little secret part. Why do doctors say there's no long-term side effects? You know why we say that? Because no one is looking or studying to see if there are any long-term side effects. Blood pressure pills, diabetic pills, stomach pills, cholesterol pills, pain pills, anti-inflammatory pills, and hundreds of medications, virtually all of them, are given to patients without any apparent concern of what the medication will do to you 10, 20, 30, 40 years from now. This is absolutely true, folks. There are no long-term studies that have ever been done that I can find on the medical database that have ever been done over 7 or 8 years on any medication. There just aren't any. But let's do an example to make it clear. There's an epidemic going on right now. And you know what that epidemic is? It's the overuse of over-the-counter medications. And these are called PPI drugs, proton pump inhibitors. You know, there's a couple name brands out there that have been there like 20 years. These drugs started out, I remember after about 5 years I was a doctor. I mean, some of the name brands are Prevacid or Prilosec. They used to be prescription, but then they went over the counter because they were deemed magically safe. They were declared safe by the Department of the U.S. government. It's the magic department. They were magically declared safe with no long-term evidence to show that they are. I mean, they probably did some 5 to 7 year studies, but that's about it. Anyway, I've been trying to contact the Department of Magic for many years and I can't seem to find him. I think the number's disconnected. Anyway, as I said, without any studies over 10 years in duration, you can now, over the counter, buy all the PPIs you want, proton pump inhibitors. Now, in spite of numerous small studies and review articles that are warning doctors that there are measurable increases in bone fractures, dementia, pneumonia, B12 deficiencies, and many more side effects from the chronic overuse of PPIs, they are still over the counter, and I have patients come in still telling me they're eating them like candy. But because there are not any long-term studies done showing serious side effects, this means, by definition, they must be safe. That logic, that mindset is mind-bogglingly stupid. I mean, let's talk about this. Let's talk about a few reasons why that's ridiculous. First, the longer drugs stay on the market without obvious side effects connected to the drugs, the more difficult it becomes to connect any side effect to the drug. That's because all the other lifestyle factors that can affect the organs of your body. How much booze you drink, stress, sleep deprivation, and on and on and on. So this always gives an alternative explanation to why your organs are damaged. I mean, how do you know, Dr. Debunk, it was the drug that makes people feel so crappy? It's just their crappy lifestyle. Well, yeah, that's true. And it's probably true much more often than it's the drug. But just because there's no studies showing the direct side effects from the long-term drug use, we deem them magically safe. PPIs must be safe because no drugs or no studies show that they're unsafe. But they don't tell you that no studies are being done. It's always the patient's lifestyle. Like I just said, no one is doing long-term specific studies on any drugs that I can find. Now, that doesn't mean they're not out there, but I've looked pretty hard, folks. I don't find them. So in other words, no one is following what is happening to patients now for at least 10 years can get all the PPIs they want, and they're just taking them. There's no analysis going on. The problem is, as I've said, we're not looking at anything. So this logic is ridiculous. Okay, now a word from our sponsors. Hi everyone, it's the cold and flu season again, and this year's pretty nasty. Well, do you know what the best cold and flu remedy is? Well, it's a remedy that would be natural, strong, kills viruses, and has some science to show that it really works. Well, that's KSK Cold Spray. KSK Cold Spray is an all-natural, germicidal spray that eliminates cold and flu symptoms in 24 to 48 hours. I proved it in a study of 200 patients, and now we've probably had 700 people that have used the spray. Every year it's curing hundreds of my patients. So don't be miserable anymore. Go to kskcold.com, that's kskcold.com, and you'll love what you read. I'm Dr. Debunk, the medical truth teller. Welcome back. Okay, the second problem is, what do PPIs do? How do they work? So that was a general issue with all drugs, but there's something specific about PPIs that's really bad. PPIs, proton pump inhibitors, they essentially shut down the enzymes of the stomach to minimize acid production. They don't just interfere or slow down production like the previous class of medications like Tagamet or Pepcid. What PPIs do is much stronger. Theoretically, you could take enough of them to stop the enzymes from working at all. So here's the problem. If they shut down specific enzymes in the stomach, what other similar enzymes are they shutting down in the body, in other organ systems? See, there's over 2,000 families of enzymes in the human body. It's well into the 3,000 different enzymes. And so let's say we numbered all these enzymes. I mean, we haven't, but let's just say we did. And let's say PPIs block enzymes from 100 to 110. Well, guess what, folks? They're also blocking enzymes number 90 to 99, and they're also partially blocking enzymes 111 to 120. It's broad. It's not specific for just those enzymes. To believe that no other enzyme systems are being affected is to believe in little green Martians. Yeah, they might be on Mars, but really? Good luck with that. Any drug that affects an enzyme will also affect the cousin enzymes. Here's what really stinks about it. These other enzymes, the cousin ones, they might be in your brain. They might be in your heart. They might be in your pancreas. We don't know. I mean, it's nuts. Like, there are these drugs called quinolones, which are antibiotics. And now, after 20 years, we've learned that they cause spontaneous tendon rupture of Achilles tendons. Most of the time, you will just bust your Achilles tendon in half if you take too many quinolones. What the heck does an antibiotic have to do with a tendon? It's the cousin enzymes. And so we're seeing PPIs do these other things with memory dementia, what I mentioned earlier. So this is not a good movie, folks. Okay, the third thing that gets back to kind of the first, as I mentioned, all drugs, most drugs, in some fashion, are metabolized by the liver and kidneys. And so we have a specific lifespan of doing that. What that means is, finally, the liver or kidney's ability will be used up to metabolize PPIs and get rid of them. It'll just wear out. The chronic use of any drug will finally wear out the specific metabolic pathway that's getting rid of the drug, and then the drug becomes toxic. The classic example you all know is booze, alcohol. We've studied booze so long, we know exactly. I can tell you how to kill your liver. Okay, everybody raise their hand if you want to kill your liver. Here's how you do it. All you have to do is drink a half a pint to a pint of whiskey every day. And then 15 to 20 years later, just like clockwork, you're dead meat. Your liver will become cirrhotic, that means dead, and then you will die. So we know exactly how much. Any drug or medication does the same thing. It's just how long and how much will it take is unknown because, again, there are no studies to determine that. We act like it doesn't exist. What do you think the classical medical response would be to what I've just said? Get ready. Here it comes. I've heard this and we'll hear it forever. There is no medical evidence to show that what Dr. Debunk is saying here is true. There is no medical evidence to show that what the Dr. Debunk here is saying is true. That's because nobody's studying the problem. And this is one of the most screwy beliefs we have in medicine. It's mind-boggling that we go to school for 10 to 16 years and believe this factoid, this dopey belief. And here it is, get ready. In medicine, something only exists if we determine it exists by our studies. Let me say that again. It's not that we're not acknowledging that we haven't studied it. That's not the issue. We have this thing that we don't even think about, but it says that we have to study something. And then once we study it, then we can say, okay, well, this is how it works. But if we haven't studied it yet, it doesn't exist. It's not that we haven't studied it or we don't know. It doesn't exist. Is that nuts? Now, I know you may not believe that, but it's kind of an incessant little background thinking we have that we doctors is like, well, there's no scientific study, so I don't know. I don't believe it. Reality in medicine is based on what we study. If we don't study it, it's not reality. It doesn't exist. Because it removes the word possibility. Therefore, if we don't study it, it's not even possible. And that's a dangerous thing. Now, not all of medicine is like this, and all doctors are like this, but too much of it is. It's what's led to this endless use and increased use of drugs without any concern for things that we know, but we just don't stop and think about. Okay, so I've beat up doctors enough for today. Let me conclude. There is plenty of circumstantial evidence in medicine to show that all drugs, medications, whatever you want to call them, natural or synthetically derived, will finally become toxic to your liver, kidneys, and other organs of your body if you take them too long. So the answer, which is finally the good part, the answer to this problem is simple. Learn how to live optimally healthy so as to reduce your need for daily medications. If you're not broken with disease, you need to reduce the need to zero, which is mostly possible. You must change your life. You must learn to do the things that make your body work normally, which it will do. The most important principle of optimal health is, get ready, here it comes. The fact is your body fixes itself without any help from the doctors. The human body has this most amazing feature. It fixes itself. It always wants to fix itself. We live lives that inhibit the fixing, and we have to stop doing that. And we have to promote the life things that increase the ability of the body to fix itself. Therefore, ergo, you will be able to reduce your medication needs to zero. And then, if you are broken with disease, you will probably need some medications, but you can reduce the need for how much you take and how many you take by living optimal health lifestyle principles. You can take a whole lot less medicines. I mean, there's some specialists in the town I practice that really don't like me because it's always the same movie. You're always taking people off medications. Why do you do that? You're always taking them off. Anyway, we don't really talk much. So you can, even if you're broken with disease, improve your health status and reduce your medication needs. Generally, though, many of you will not be able to get off them. I mean, if you're broken with disease and your blood pressure goes haywire, even when you're doing everything healthy you can, then you need to be on blood pressure pills or other medications. So I have to put that little disclaimer in part. Don't stop your medications and have abnormal vital parameters of your body. Don't do that. If you do that, you'll be dead in 10 to 20 years or less. Again, broken with disease is different than not broken with disease. So the real finally now is, Intermittent use of medication really seems to be safe. It doesn't affect your ability to have a full optimal life. It's just when they become chronic. And that's it. I'm Dr. Debunk, and this whole topic has been debunked. Hi, everyone. It's the cold and flu season again, and this year's pretty nasty. Well, do you know what the best cold and flu remedy is? Well, it's a remedy that would be natural, strong, kills viruses, and has some science to show that it really works. Well, that's KSK Cold Spray. KSK Cold Spray is an all-natural, germicidal spray that eliminates cold and flu symptoms in 24 to 48 hours. I proved it in a study of 200 patients, and now we've probably had 700 people that have used the spray. Every year it's curing hundreds of my patients. So don't be miserable anymore. Go to kskcold.com, that's kskcold.com, and you'll love what you read. I'm Dr. Debunk, the medical truth teller.